My name is LARSON. I'm from Sweden. My ambition this morning is to share with you some of my experiences in the field of what we usually refer to as e-health. In addition to actually sharing some of the factual experiences, some of the things that have happened, commenting on some of the challenges that were mentioned just now, I will also share with you things that I've learned when it comes to management, for example, and leadership. And I think that's general. It doesn't only have to do with e-health. It has to do with managing organizations, changing people's behavior, learning from all these processes. And what I will start with is actually to give you just a background then. In addition to the brief presentations you had of the situation in France, I'll give you a brief presentation about the status or the situation in Sweden when it comes to e-health. And then once again, since you've been through some of these things, you've heard similar presentations, please ask questions.
As a potential patient, what would you consider as a satisfactory criterion?
The reimbursement process behind in pharmacy, because there's a whole logistic behind it, and I know that as pharmacies get the prescriptions, they have to make some copies, submit it to the national insurance company, and then they get the money back. I mean, the moment the pharmacy gets the prescription, it can automatically go to the health insurer, and it can be deducted on the spot, or at least with some days lag.
Please, what are the medical benefits for the patients?
I would say something about scalability and the availability of the e-prescription in all regions of the country. That is one more factor. That is a key performance indicator. Accessibility of doctors and patients, the access to e-prescription in general.
I have a question for Mr. Larson. Did your government conducted such studies about the
electronic health records?
Yeah.
In principle, no. And as I mentioned, I showed you, we haven't even looked into the effect of electronic prescribing on the drug bill, because that's narrowing it down. So you think that question should probably be easier to answer. If you look at the electronic health record, that's it's a sort of very general tool, so it's difficult. One has to narrow it down to specific comments. I mean, the number of mistakes made or something like that. Whereas it comes to electronic prescribing, you could assume at least, or have a hypothesis that it would lower the total spending on pharmaceuticals. And as I mentioned to you, if you look at it on a macro level, you can't see any sign of that. That's, of course, something that has to be studied much more in detail. And to answer your question, no, the government hasn't done that. And the regions do it because they're paying, because they feel it in their pocket. So they're following this, but they do it on from day-to-day basis to make sure that they have control over things. Very few scientific studies have been made on this, and I think that's quite surprising, to be honest, because there are specific indicators that can be identified, especially if you go down to a more narrow field like the use of medicine. You can even select certain treatment groups, etc., and see whether it actually makes a difference over time. There are extremely few studies done on this, and I think that's an interesting field. I mean, I would encourage any one of you to dig into it, and if you need any contacts or background information, I'll be happy to assist, because I mean, it's still a green field. It hasn't been looked into. And a lot of the things that we do build on the assumption that it makes sense. And we can see it from an anecdotal perspective. We can, you have the stories about the patient who were prescribed the wrong drugs or drugs that actually interacted, and that mistake was avoided by having an electronic system in place. So you can see those examples. But then, to be honest, on the other side, somewhere between 15 and 20 deaths, unnecessary deaths, because of electronic health records. These, again, they're on an anecdotal level. These are patients where information was stored electronically, but when the patient came to the emergency room, the information couldn't be retrieved. So they were giving the wrong medication and they had a bleeding or whatever. And some of those cases have been, on an individual basis, they're looked into because you have to for regulatory reasons. But one has to be, I think, a bit humble to realize that these are they're complex systems interfering with extremely complex systems, healthcare. So one has to narrow it down to very specific questions to get at least a little fragment of the truth. And very little is done on that domain. So, and that's encouraging. I mean, there's a lot left to do for people like you.
According to your experience, how we should process to make them apply the DMP by maybe obligation, incentive, maybe it's a lack of information of the benefits?
Well, sometimes you face a situation where you're not making reasonable progress. You expect that people will actually sign up, and they're not. And I think it's very important to really look into the fact, what's actually preventing people from joining in. A lot of people have, I wouldn't call them hidden agendas, but they have concerns that they, for different reasons, don't want to voice. And it's, as a leader or a manager, it's important to really dig into that and to really understand, what is actually the key factor. And very often it boils down to money, which some people are embarrassed to actually put up as a reason for not joining in or whatever. The other component that I've found quite frequently is the notion of control. I don't know at all whether that's applicable in your case, but I find it in other countries where I've been engaged. And I think most high-level professionals, doctors, engineers, architects, or what have you, professors, they have a very clear mind of their independence. So basically that covers the thoughts and the experiences that I wanted to share with you. This is a fantastic field to work in. As I mentioned, I started off as a healthcare practitioner in clinical work. I'm very passionate about healthcare. It's the most important industry one can engage in. It's the most rewarding industry one can engage in. And there's always reasons to change it. There are always reasons to improve it for individual patients and citizens. And I think that's one of the strongest driving forces that one can have in a professional life. I'm very pleased that I choose that field to work in. So thank you very much.